morning. I'm Mike Haley, honored to serve here for 7 years now as CEO with IU Health, and I'm here simply to welcome you and introduce John, who most of you know by now. He's becoming quite a well-known person when it comes to wellness. I will again tell you how much I appreciate this and your participation and support for our Community Health Wellness Initiative. I think you all know by now that healthcare is changing dramatically, both as employers and as consumers. And for us, while we remain quite busy as a hospital and full way too many days, our priority continues to be to figure out how we are going to be successful in population health management. We are accountable for the wellness of our communities as hospitals now across the nation, and the government has each year increased the risk to hospitals for our reimbursement. So I know when Dan Evans, my CEO, came to me and this was changing a year or two ago, he came to me and he said, Mike, you need to change the health in Muncie, Indiana. Well, how long do I have, Dan? He said, well, go to the grocery stores, go to Marsh and tell them to create aisles and health food aisles. So I did. And the manager honestly said, Mike, I'd love to, but I'd be fired because we put it out there and no one buys it. So I went back to Dan and we are taking a different approach. We're going to recognize reality. It takes a village, it takes all of us, and because we all have the same desires. If we all work together with all the resources that you bring, with what we can bring, I'm confident, while it will not happen overnight, perhaps a 5-year, 10-year journey, we're going to start seeing a difference in our population. My own Connect Purpose story, I was not blessed with good genes in my family. There were no males in my family who lived to be 50. Great-grandfather, grandfather, father. Now the good news is they were all different conditions, heart attacks, colon cancer, and so forth. So the challenge was I had to make a decision growing up a Hoosier. Keep eating the biscuits and gravy, follow my dad's footsteps, red meat every night, no vegetables, or up here say, you know what, I'm not buying it. It's not all genes. So I changed my diet. Well, I was always an athlete. That helped. I believe my coach. That's one of the few. The coach said, don't smoke. I didn't smoke. I then stayed on my diet, continued to work out, continued to focus on the big 50th birthday. And actually, by the time it came, it was just another birthday, because I knew in my mind that if you take control of your own health, you can do it. You can live as long as you want, and it's a quality of life. So I'm passionate about this. I talk to my kids about it all the time. Hopefully they will follow the same footsteps. So again, I'm going to introduce John, and I have to go get my wellness test right now, as a matter of fact. My secretary says stay away from the food before the test, so I have to go do that. But thank you again for coming.
Good morning, everybody. I appreciate you coming out today. It's great to see so many folks. We've got some folks who may be new to what we're going to talk about. We've got some folks who are existing partners, and we've got some steering committee members here as well. So I'm going to get started. I'm going to talk for about 20 minutes and explain what we're up to with this Healthy Community Alliance business. And then we're going to hear from a couple of our partners, and then we'll have some Q&A sessions, and we'll have you out of here before 8 o'clock. So again, we really appreciate you coming today. So I'm John Disher. I'm the Community Outreach Manager for IU Health's East Central region, which includes Ball Hospital and Blackford Hospital to the north. And I am also serving as kind of the project facilitator for a really unique effort called the Healthy Community Alliance. The ultimate goal of the Healthy Community Alliance is pretty simple. We want to improve the health of the population in Delaware and Blackford counties and decrease or lessen the impact of chronic disease in our communities. It's pretty simple. Just a little bit of background. In 2011, 2012, IU Health Ball Hospital did a community health needs assessment. And during that time, we found, not surprisingly, that our community is not very fit. Our community smokes too much and have a lot of bad habits. So we put together a community outreach committee as part of the IU Health Ball Hospital Foundation. And we put together some partnerships with the YMCA and the schools and some other systems to basically focus on obesity prevention and tobacco. And those were pretty successful. But in 2014, our committee said, what can we do more? What can we have a greater impact? And we went to Indianapolis and we studied what we called, was new to us at that time, a collective impact coalition, health coalition, called the Top 10 by 2025 in Indianapolis. And the light bulb went off. We said, wow, this collective impact model could work in our community to change what's happening with our health and wellness scene. So in 2015, we took our committee and we expanded it with more members from across the community, stakeholders from across the community, and formed the Healthy Community Alliance in 2015. And we went to work last year putting together a framework so we'd be in a position to invite you to be a part of what we have planned for the last year. So that's today, you're going to get an invitation for me to be a part of this. Our steering committee is basically a cross-section of the community. We've got folks from, as you would imagine, the health and wellness sector. But guess what? We've also got folks from government, from economics, from education. We felt that was really important because the only way the collective impact model works, I'm going to talk about this more in a minute, is if we get folks from all across the community to be a part of this. That's what, it can't just be the health and wellness segment, it has to be all segments, industry, etc., everything. And by the way, retired banker is Steve Anderson, in case you didn't So this group, this steering committee put together, as you would imagine, we put together a mission, a vision. All that is in the packets at your table. You can see all the things that we've been working on the last year to create this framework. But essentially, we want to improve the health and well-being of our community is what we're up to. We want to use what's called the collective impact model, which is new to a lot of people. It was new to me when we first heard about it at 14, but I've studied up on it, and we're really impressed with the potential of this model. Well, basically the way it works is that everyone has a common agenda, shared measurement across that agenda, continuous communication, and then mutually reinforcing activities among the people and organizations that are participating. And I'll talk about what that means in a minute. Here's our steering committee members. If you're a steering committee member, wave your hand right now so we can get a feel for how many of us in the room. So thank you for helping put this together. Their leadership was instrumental in getting us to this point. I really appreciate everyone. There's also a list at your table of our steering committee members. So now, I don't need to tell most of you, we actually in Delaware County have some pretty great resources. We've got the Cardinal Greenway, we've got lots of parks, we've got wonderful YMCA facilities, we've got the nationally recognized Fisher Institute for Wellness, we've got a university that has marvelous programs, we've got other organizations that offer programs related to diet, exercise, you name it. We've got lots of coalitions engaged around health. We've got media partners that care about our community and want to make a difference. We've got a fantastic farmers market. We've got more run-walk opportunities than you can imagine in our community. Thank you, Steve, for your work in that area. But lots and lots of things happening in terms of health and wellness in our community. But, well, if you look at our health status, okay, Delaware County, we're ranked 87th out of 92 counties in Indiana by the county health rankings. Indiana is ranked 42nd out of 50 in the United States. So that means not only are we at the bottom of Indiana in terms of our health status, we're at the bottom of the country. So we've got work to do. The good news is, where can we go from here? Up. We can just go up. We can just get better. So that's the good news. If you look at around our county, 25% of us smoke, 33% are considered obese, 14.5% of our preschool children are obese. 31% of adults report no leisure time activity in their day, and almost 13% of us have diabetes, and that number is just rising so rapidly right now. So we decided that we put together this coalition, this alliance around the collective impact model, and we would decide that we would focus in Delaware and Blackford counties. Obviously, we have a hospital niche from IU Health, so IU Health is supporting this initiative. And we're really going to work on 3 goal areas to get started: increasing physical activity, improving nutrition, and reducing tobacco use. The components of our alliance are a steering committee, who you've just met some of the members, a broader coalition membership to carry out this, what we will call later a sphere of influence, and then work groups around these 3 priority areas, plus also another group around communication and measurement. The backbone organization for this is IU Health Baltimore Hospital. They're providing resources to get this going and to continue it. They provide me as a resource as the kind of the coordinator of this. So Ball Hospital is very, very supportive. The final piece is a technology platform to help us communicate what we're doing, where we've been, where we're going. And I'll talk about that towards the end of the presentation. So I think all of us in the room know that lifestyle behaviors contribute to chronic disease, and those 3 things that we've talked about that we want to focus on, poor nutrition, lack of physical activity, and tobacco use, are so important for us to change in our community. So how do we change behaviors, how do we change attitudes, and how do we change the culture? Okay, that's what we have to do. We're bottom of Indiana. Indiana's the bottom of the United States. We've got to change our culture. How do we do that? So I like to show this little, a lot of people laugh when I show them this low-tech kind of a slide here, but basically all of you, for the most part, are represented here. We've got great organizations in our community. They're doing great work. They all have their own missions and visions and goals, and that's wonderful. But when it comes to health and wellness, we may be going in slightly different directions, hence the arrows. We're all doing good things, but we're going in different directions. And the thought behind what we're trying to do is that each of these organizations represents what I like to call is a sphere of influence, okay? And what that means is that these organizations touch people in some way, whether it's they have employees, whether they have customers, whether they have an audience, if they're in media, they all can touch people in some way. So for our collective impact model thinking, okay, a sphere of influence, that's you. You guys are all spheres of influence. It's the ability of partners to persuade others to make good decisions about nutrition, physical activity, and tobacco use. So what we want to do is engage organizations to be spheres of influence across our 2 counties. So our model is pretty simple. We have a steering committee that's put together the framework of this initiative, and then we're going to basically work with all of our partners in the community and align those partners as new coalition or alliance members around these 3 areas: nutrition, physical activity, and tobacco. Okay. What we're going to do is we're going to form work teams, and those work teams will work on these initiatives, and I'll share more about that in just a second about how those will work. So we get those work teams going. The collective model impact starts to come into play as we have enough partners to kind of spread the word through their spheres of influence. We can measure what we're doing, and ultimately we want to make a change of improved health, reduce chronic disease in our community over time. Now, I'm not naive. I know this isn't going to happen tomorrow or next week, but we want to get started, and we want to make this a marathon project that continues for a long time. And again, the hospital is very committed to being the backbone for this and keeping it going for a very long time. I put a little note here about grants and funding. The Alliance itself isn't going to necessarily pursue grants and funding, but partner members certainly, applying for a grant, could say they're part of this larger organization and talk about the goals of that organization. That certainly would help with getting funding for organizations that are part of our Alliance. So, collective impact. Here's it in simple, okay? We influence people where they gather. We influence them around shared goals with consistent messaging, okay? And those mutually reinforcing activities. So I'll be honest with you. This is a sales pitch this morning, okay? We're seeking partners. If you didn't raise your hand as a steering committee member, and if you're not a partner, we're here today to maybe convince you to become a partner in this work that we're trying to do. So we're seeking folks that are basically willing to promote that improved nutrition, increased physical activity, and reduce tobacco use among their sphere of influence, your sphere of influence. Now, you may already be doing that, and that's even better. If you are an organization that has employee wellness program, you've got great initiatives, that's perfect because you can be part of our alliance and you can help share best practices with other organizations that may not be at the same place you are. So, collective impact, here's my vision of the future, okay, with this collective impact model. I get up in the morning and I get my hair done, okay, and I'm sitting there reading my newspaper, got my cup of coffee, and I read a great article about 10 ways I can improve my physical activity, and just even though I'm busy, how I can get more physical activity in my daily routine. I read that in the newspaper. I put my kid on the bus, they go to school, and they get 60 minutes of physical activity integrated into their day somehow, and they also learn continually, in addition to all the great academic programs they're exposed to, they also learn about a healthy lifestyle, so they get lifetime habits ingrained in them. I'm driving to work and I turn on the radio and I hear my favorite local radio personality telling me to put down that donut and pick up something healthier, okay? So I get a positive health message from my friendly radio DJ. I get to work and maybe I've got an employee wellness program. Maybe it's like Mike Haley, I get my screening done every year and I get an incentive. If my BMI is below a certain point, I get a discount on my health insurance. I have a fitness facility at lunch I can work out. Or maybe I just take a walk at my break and I go out around the building. Later that day I go to the dentist's office and I talk to my dentist and tell them about how I've been really hoping to quit smoking, and they say, well, you know what, we can refer you to 1-800-QUIT-NOW. It's a great resource to help you quit smoking. And I get referred and I get enrolled in that program, and perhaps I kick that habit that I've been working on for so long. And then finally, maybe that evening, I gather along the White River with some friends in a walking club, and I go for a little neighborhood walk with some folks as part of my daily routine to get more physical activity. That's the idea of collective impact. Wherever I go, I get influenced in all those places I go, whether it be workplace, school, media, dentist, anywhere I go, I'm getting influenced in some way. And the idea is the more we can have consistent messaging, the more people have influence, the more chance we can change those behaviors and change that culture of health in our community. So these are our current alliance partners. Okay, we've got 25 partners so far. We appreciate that. If you're a partner, just raise your hand real quick if you're part of one of these organizations so we can kind of see. Thank you again for being involved in our organization and helping us get such a great start. So I talked about work groups, and the idea, once we get enough partners to get some critical mass here, we'll form some work groups, and we'll basically survey our current environment, find out what programs and great resources we have already that we can maybe share with each other, come up with some tactics that partners can use no matter what their business is, no matter what their organization does, come up with some tactics they can use in this collective impact model, share best practices, and work on, again, those mutually reinforcing activities. If I'm a bank, what can I do to help influence my customers to a healthy lifestyle? If I make widgets, what can I do with my employees to help influence them? We're going to do that around shared measurement and goals because we want to make sure that we know we have a target and we know that we're moving towards that target. So we're going to have some shared measurement and goals. I'm going to step away for just a second and say, here's what we're not trying to do. A lot of you, we've done this. We've gotten in a room together and we tackle a problem and we get really excited about the answer. And usually it's to create some big event. We're going to create a big event, bring a bunch of people in, and we're going to grab and shake them, or they're going to walk away from that event changed, right? That's not what we're trying to do. We're not trying to create another big event. We're trying to utilize the resources we already have. We're trying to basically catalyze people to get these initiatives aligned so that no matter where anybody goes, they're getting influenced in a positive way. And we're doing that all around these aligned goals and objectives. So this is also in your packet, but we had a committee that came together and put together some actual goals for our group, okay? Around those three areas: increasing physical activity, improving nutrition, and decreasing tobacco use. So we've got actual measurable goals, okay? And then what we did was we came up with our goals. We came up with a website that helps us measure where we're at. And that website, I'll show you in just a second, also shares best practices, funding opportunities for partners, and basically just becomes a communication vehicle for us. Now our website is www.healthycommunityalliance.org, and basically this is from a vendor in Berkeley, California that specializes in doing these types of web platforms for communities, for hospitals, for health departments, where they're trying to do collective impact across their community. So I would encourage you to check out our website. But basically, in addition to the usual things like you'd see about, learn more about our organization and some of the highlights of what we're doing, there is a really cool community dashboard that has over 100 different health indicators with really neat little gauges, okay? I'll go to the next slide. Little neat little gauges that kind of shows us, in comparison to other counties or other parts of the country, how we're doing. And so we've got indicators for cancer, for diabetes, for exercise, nutrition, weight. So this will help us know where we've been and where we're going and if we're getting there or not. So it's a very valuable tool. If you've ever searched for this kind of information, it can just drive you crazy because there's all sorts of different sites that have bits and pieces of it. this company that we're working with, they put it all together for us. They get the most current publicly available data. They update it as soon as they get it in their hands. So it's constantly being updated. So we always know this is the freshest publicly available data for us to work with. And that's really important too. Here's just a close-up of one of the examples. It's adults who are obese. It tells us basically what the data source is. Okay, it basically gives us information on the right. We can see, are there other indicators that go with that, like fast food restaurant density, etc. Are there some promising practices that we can click on and learn about, things that will help us take on in our organizations trying to prevent obesity? Also, are there funding opportunities off to the right we can click on for funding opportunities for organizations that are in this fight against obesity? This is the promising practice page. It shows you all these different practices that you can use for obesity or other types of health initiatives. Here's a funding opportunity, a list of funding opportunities across the nation. Again, this gets updated on a regular basis to help our partners understand what grants they could possibly go after that are available out there. And there's also a demographics dashboard. So again, puts all that demographic information, census, diversity, etc., all in one place. So very helpful tool, all in one place. So next steps, we're basically in the midst of partner recruitment. We really can't get started making a difference until we get enough partners on board so that collective impact model will work. So once we do that, once we get enough partners and some critical mass, we'll kind of delve into that work group process and getting our partners to help us develop these tactics around these goal areas. And then of course we want our partners to basically commit to doing this, commit to being a part of this in the long term, in the long run here in our community. Now, I'm making a sales pitch, so I've got to tell you what the benefits are, okay? All right, so I'm going to tell you the good stuff. Obviously, here's an opportunity for our organizations and our community to participate in proven practices that lower healthcare costs among employees and other populations that we're involved with, okay? It's a great way to learn about ways to support policy and environmental changes, again, that make our community attractive for economic development. That's very important to all of us. As I mentioned, we've got the website with access to continually updated data about these health indicators. And it's an opportunity for you to share and learn about best practices from across the country as well as here in our local area. It also is an opportunity to learn about funding opportunities and maybe partner up with other organizations to go after grants and so forth. And most importantly for me anyway, it's a way for all of us to be a part of finding a solution to these health challenges that we have. We've got to find a solution. We can't keep going in the same direction we've been going. We've got to make a change. We've got to turn the ship. What's the commitment? It's pretty simple. At your table, there's a partnership agreement. It's a simple agreement. We ask as our partners to basically designate someone, a representative, and then select a priority area, or if you're ambitious, select all 3 priorities or all 4, including the communications work group. Participate in our quarterly alliance meetings, okay, so we can share what's going on with the alliance, and then basically just commit to putting some of these strategies and best practices to work within your area of influence on folks that you have influence over. So that was my 20-minute blitz spiel at you, my sales pitch to you. I'd like to take a moment, maybe hear from 1 or 2 of our partners. I know that Mitch is here from Ball State, and I'm going to ask him maybe just to share a little bit about why Ball State was one of our early partners to sign up, get involved in this. They bring a lot to the table. Not only do they have an area of influence, they have experts that can help us as we try to influence people. So, Mitch.
Well, if I wasn't already, I'm ready to sign up now. How about that? Thank you, Gary. We would definitely like to thank John and IU Health Ball Memorial Foundation for spearheading this collective effort. I've been at Ball State University for 30 years, and I've been in a health-related program, so I can speak from experience that we do have all the challenges that John listed on several of his slides. We've been working hard over the years, but we continue to have these sorts of health issues. And so I think this new opportunity to maybe work as an alliance could make some inroads into the behaviors within the community. So I'm excited. I know that Ball State University currently has hundreds of faculty and staff and students that are engaged in either health education programs, interventions on many of the things that you saw on several of the slides, But once again, we're excited at this point in time to come together with many of the other partners in the community to try and make a difference. I think the issue of impact is important, and I like the notion of the dashboard. I don't know who's going to control the dashboard, but I'll be checking in from time to time to see if we're moving the dial. We have a new initiative at Ball State University. Some of you may have seen it in the paper. We will be launching our new College of Health academically in the fall semester. This will be bringing together a number of health-related academic programs as well as clinics and students that will be commingling in ways for their educational experience that they have not done so in the past in their silos in different colleges. And it's good timing for us to get this initiative in front of the new college. I'll be speaking about it with my colleagues in the College of Health, many of whom actually interact with a number of the partners represented here today already. One of the things that we might be able to bring to the table is to help with the research efforts and maybe the data analytics that might go along with us being able to track the kinds of changes and the impact that we're going to have with this initiative. So again, on behalf of Ball State University, it's a thrill to be a part of this, and we look forward to the partnership.
I didn't warn her about this, but I'm going to ask Terry to maybe just say a word or two. One of our other partners is the City of Muncie, and Terry Whit Bailey's been serving on our steering committee, and I just kind of going to call her up and ask her just a quick word about why it's important to our city to be involved in this from the city government standpoint.
Thank you, John, for putting me on the spot this morning. Good morning to everyone. Well, I think it's pretty obvious that that is something that needs to be in place. And we had these conversations early on. If the city government and the mayor's office is taking an initiative and taking responsibility for what the city is doing in terms of vision for the city, then this needs to be one of the things. We have been talking about it. We've been working with our own wellness committee at the City of Muncie, but that's just within our own little bubble. Well, we need to be representative of the whole community. And so we're working with John. We're working also with J.C. Foley. We started out with the Tobacco Free Coalition, working with our employees, but we need to go beyond that. And John had an opportunity to meet with the mayor about a month ago, and he was immediately on board and said, what can we do to help? And so our job is to push the message of this initiative to be a component, a strong component, and to work with and to do what he's telling us to do, because we should be doing it, but also just to share that message. So we're happy to be a partner.
Thank you, Terry. Thank you. Terry mentioned J.C. Foley. J.C. is the director of the Tobacco Free Coalition of Delaware County. And I might mention that I said we had 3 work groups. One of our work groups is around tobacco, and actually the coalition is our work group. So we already have that work group up and running. We've recently kind of recalibrated, redesigned the coalition to fit into the alliance model and into the collective impact model. So we appreciate J.C. Wave your hand, J.C. Her work in the coalition. I'd like to open it up for any questions. If I can't answer a question, I've got my great steering committee here that can help me with it. So does anyone have any questions about what we talked about this morning? All right, so everybody said, yes, Susan.
This isn't really so much a question, just a comment that I sort of thought of thinking about this. You know, I work out of Marion Hunt Library, right next door to Southview Elementary School. Probably 90% of the kids there are on free or reduced lunch. I would love to see, and I hate to put other people forward, but I would love to see the food banks be a part of this too. Because lots of times they're going to be the frontline person interacting with that family, with the students. They're getting ready to change their model for free food distribution from the centralized area at Fort Warner to actually giving away the food within the city schools. So I think that would be a really important partner for this, to speak directly to people who are maybe most in need of nutrition information.
Thank you, that's a great observation. My ultimate goal is I would love to see every single organization in this community be a part of this. I mean, I think that's the way we have the most effectiveness. But yeah, absolutely, we want to target them, so thank you. Any other questions? Yes?
I'm from the food bank, so
Oh,
my name's
yeah.
Samantha Martin, so we're all
Yes.
involved. And
See,
I
yes.
don't know what you're saying, but you know, I'm here and committed.
Great.
You might mention that there are others that aren't on the list that.
Yeah, so we've been in contact, we've kind of been in what I call kind of a soft recruiting phase, where I've been going out talking to organizations about being a part of this. They've expressed an absolute desire to be a part of it, but larger companies, you know, there's a paperwork trail you have to go through. So, for instance, some of you today can probably, I saw Micah, bless you, I saw you signing the partnership agreement. I love that. Not all of us might be in a position to do that for our organizations. So we've got a lot of organizations that are in that process of already looking at that, and we appreciate that. Our most recent partners that we just signed on, it was United Way of Delaware County, just got their agreement a couple days ago, and we're really excited about that. One of our media partners, 104.1 Wolf Boom Radio, just signed on recently and wants to be a part of this group, so we're really excited about that. So we've got a lot of good people out there we've been talking to, but this is kind of our first public announcement. Yes?
How do the two counties work together? A lot of what you talked about so far is definitely centered on Delaware, and I understand
Yes,
why,
yes,
because we're
yes.
physically located.
Right,
How
yeah.
do the two counties, how are there synergies that we can?
That's a really good situation. For instance, in Blackford County, they do not have a tobacco coalition. So we anticipate that we're going to be able to help take some of our Delaware County resources and help them in Blackford County with some expertise and help get them started. They will have probably a separate work group scenario because their community is unique, it's different than ours, and we recognize that. We held a program similar to this in Blackford County in late December last year, and we had, I think, 23 different organizations represented, all very interested. I signed up 5 partners that night and several since then, so they're very excited, but yes, there will be kind of a separate initiative in terms of getting folks in that community moving, because they are separate communities. But we'll be able to share some things back and forth, we'll be able to share talent, ideas, all those sorts of things. So we're going to have a great idea pool. Once we get this going, get these work groups and tactics, and we're going to have some great ideas. So, yes. Yes, Lenny.
Now, I see you have some physicians on the group here, which is great. Is the hospital going to have any initiative through the hospital kind of physician practices to have them involved in communicating this information to all the patients?
Yeah, so that's a good question. Our physician practices right now are working on, they call them population health initiatives. They're involved in things of making sure that people have immunizations, that they get regular checkups, those sorts of things. We would anticipate at some point in time that they're going to also kind of adapt some of this healthy messaging if they're not already. So absolutely, we're going to bring them into the fold as well. That's our plan as well, absolutely. Some of our practices are already really engaged in this. Our family medicine residency is really doing some incredible things in that arena. So, good observation. Any other questions?
John?
Yes,
Quick question.
Micah.
So I see that there's one of the committees that's focused on measurement and communication. Who's focusing on the baseline of what we're already doing, as far as what programs or initiatives are already going on?
Yeah.
So that one, if we want to be involved in something already going on, but two, so we can know where we're starting at.
Sure, absolutely. So the question is how do we know what programs are already going on? How are we going to focus on that? And that will develop in the work group phase. Once we get that work group phase, part of that will be an inventory to find out what do we have, what can we share with each other, and we'll share it through this web platform to make sure that our partners know exactly what's available, what types of programs are out there. So we see this as a great way of breaking down some silos and getting a better communication pattern among partners about the opportunities that are available out there that can be provided to their spheres of influence. I've been told I use that phrase way too much, but I like how it sounds. Spheres of influence. Yeah. Thanks. Does that answer your question, Micah? Okay. Any other questions this morning? Okay, so if you're in a position, if you want to be a part of this movement, we'd love to have you. If you're in a position to sign a partner agreement for your organization, please do so. Leave that with me today. If you are not the person to sign that, but you think it's a great idea, which I hope you do, there's a card on your table that you can fill out that basically you can leave behind, and I will call on you, and we'll figure out who we need to talk to in your organization to get the ball rolling with them. So basically, I'd love to have you fill out one of those two items, either the card or the actual sheet, the partner agreement, and leave those behind. We'll keep you posted. As soon as our partners become enrolled, they're automatically on a mailing list. And I constantly inform our partners about what we're doing, what updates are on the website, those sorts of things to keep everybody informed. But again, I thank you for your time this morning. I'll be around for questions. Our partners and our steering committee members are here for questions. So again, thank you very much for coming out. Appreciate it.